Meanwhile, the Ministry of Health has received a donation that includes testing kits and other items that help in ambulance services worth 390 million shillings. While receiving the items donated by Korea Foundation for International Healthcare, the Minister for Health, Dr. Jenruth Acheng, appreciated the support, especially of pulse oximeters, which she says are pertinent in the COVID-19 response.
Districts near border points are in dire need of test kits because they receive a lot of people testing for COVID-19. However, these kits are few because there are no companies that manufacture such in Uganda. Such items worth 390 million shillings, including test kits for 4,000 people, and items used in ambulance services have been procured by the Korea Foundation for International Healthcare and handed over to the Ministry of Health.
Treating the more than 4,000 people for the test kits, including PCRs and the rapid test kits. It was procured from Korea, South Korea, and the other items including PPEs and more than 4,000 masks and boots and gloves, as well as mattresses for the isolation unit. So there are several items for the Masaka Relief Hospital for Komasimbis and also Ministry of Health. We are supporting to set up the ambulance stations, especially for the COVID-19. So a lot of disinfection items will go to the ambulance station.
While receiving the items, the Minister for Health, Dr. Jenruth Acheng, said the items touch at the core of the response and will support facilities that are in critical need.
One of the critical items that has been brought by Kofi are the pulse oximeters. I want to request that you supply more pulse oximeters. 8 pulse oximeters are too few. Pulse oximeters are what we put on the fingers of the patients, and it tells you whether the oxygen requirement is going down or the oxygen saturation is okay. And for COVID patients, it is very important because it is at that point that you will know whether you need to put a patient on oxygen or the patient is stable.
The Permanent Secretary, Ministry of Health, Dr. Diana Twine, said, as far as COVID is concerned, the need is bigger. She urged organizations that give support to direct it to facilities that receive the biggest number of patients.
First of all, we really want to thank you for this support. The support we have enjoyed, but also this additional support. And even we thank you for the test kit that you had already pledged earlier. One thing I wanted to request, although you support Masaka and Bukoma and Simbi, this, as far as COVID is concerned, the need is bigger. So we would really request that we have some bit of flexibility, that we would deploy things according to where the need is.
Meanwhile, following the presidential directive on testing truck drivers and retaining them until the results are back, Dr. Jenruth Acheng has explained how this is to be implemented.
When we test the truck drivers at the points of entry, the foreign nationals are not added